Good morning, everyone, and welcome and thank you for joining us today for the SmartHealth Wellbeing Assessment Organizational Reports webinar training. For those of you that don't know me, I'm Pam Walker, a member of the Washington Wellness Team at the Healthcare Authority. I work primarily with the higher education folks throughout the state to provide assistance and support to help them grow and sustain their worksite wellness programming. Today I will be co-presenting with Bennett Blodgett from Limeade, our contracted SmartHealth vendor for the Wellness Portal. So I'd like to turn it over to Bennett for just a moment or two so he can further introduce himself.
Okay, so thanks for letting us figure that out. So yeah, I just wanted to quickly touch on Limeade's whole person approach to well-being. At the base level of this, we strongly believe people are a complex system, that what happens in one area of someone's life impacts other areas. And so I think about this kind of for myself. So when I'm not exercising or eating well, it's usually because I'm stressed about family or work or something else in my life.
So things like optimism and resilience and mindfulness, they are things that can only come from our own personal perception, and they can't actually be judged by someone on the outside. And so that's why moving into the next slide, as we talk about the well-being assessment, it really is that self-assessment that we have. And so I know all of you are familiar with the well-being assessment, but the assessment is really a holistic model of well-being. It's comprehensive and it's based on extensive research. It's rooted in positive psychology, and it is self-reported. And it really does highlight the interdependencies between the diverse well-being variable and outcomes, so organizational commitment, organizational support, as well as stress, physical health, and many more. And so we wanted to, on the next slide, we wanted to really make sure that we stopped and let you know that it really is fact and research, and that we like to say it's fact, not fluff. And so spend some time on how it actually was developed. And so we followed several guiding principles to develop the assessment. First, we used positive psychology literature and behavioral science to develop the underlying theoretical model. We also used insights from medicine and sociology and organizational psychology, as well as other evidence-based field. And so as a result, the assessment focuses on individual well-being improvement and building happy, healthy, high-performing workforces. And then secondly, we base the assessment on extensive research that demonstrates the evidence of the interconnectedness of the well-being dimensions. So the dimensions actually, they relate to habits, well-being, people, and business outcome pillars of the Limeade results model. And that Limeade results model is what you see come out in SmartHealth, how we build habits and how we actually improve the health and well-being of people. Third, the assessment development process, it followed test development guidelines provided by the American Psychological Association. And so what you see in this figure is really the playing out of that process. And so the initial step was to conduct a thorough literature review. We worked with experts and stakeholders who developed and reviewed the initial well-being model that created the structure and foundation of that assessment. And then we tested and revised and honed. So we've gone through multiple iterations of this over the last 10 years to really make sure that the content is valid and that the involving participants with the characteristics resembling those in our target user groups. So some of our early customers, they piloted the revised assessment, and that helped us gather feedback and continue to iterate. And so on the next slide, you'll see that what all of that adds up to is a well-being assessment that produces reliable and valid results. And so when you think about reliability, it really is making sure that we're consistently, that the well-being assessment is consistent, that it's doing what it's supposed to do over and over again. And then that it's also valid, so that it measures what it's supposed to measure. In this case, that is, well-being, and that the questions we asked are in fact highly correlated. So you'll see in those bullets that, being physically fit and treating yourself well and having a positive outlook, they really are related to overall health and well-being. And that belief in company and job satisfaction and feeling energized at work, they're related to productivity, so on and so forth. And so, finally, in that last box, you'll see that the things that we're measuring, they really are related to real outcomes. So, this all adds up to it's reliable, so it has consistent results, it's valid, it's measuring what it's supposed to measure, and that the things that it's measuring really have real outcomes. So, you know, the dimensions, they tap into proactive health lifestyle, that they're correlated with the number of preventive visits, or the dimensions that impact individual health are correlated with medical claims. So that's all to say that the well-being assessment is a powerful tool that can really help improve the health and well-being of the SmartHealth population. So I'll stop there and pass it back over to Pam.
Okay, thank you, Bennett. All right, well, just to begin giving an overall overview of what the report provides. And what that is, it's giving you an analysis of the well-being assessment results for your organization that it will include employee demographics specific to age and gender, as well as recommendations tailored specifically to the needs of your workforce. You'll also be receiving in these reports findings under the 3 wellness dimensions of health, well-being, and productivity, cohort analysis comparisons, and recommendations for wellness program focus and development. So moving ahead here, what's in it for you? Why is this important? So this is very much a report that we hope that you can use as a assessment for understanding your population needs more specifically and informing your wellness program growth and development. It's going to provide specific information to help, again, plan and improve your wellness program, and it's the only actual source that will provide you aggregate assessment results based on your organization, including your specific results in each wellness dimension, where your organization is doing well and where there are opportunities for improvement. Again, it's going to give you comparison specific to your organization's 2015 and 2016 results, you know, emphasizing how your organization has improved. It's going to compare how your organization's 2016 results compare to the rest of SmartHealth, the rest of the state overall. And it's going to show a year-over-year analysis comparing the change in 2015 and 2016 scores for your organization's at-risk populations. And it's also going to provide you specific recommendations for areas needing improvement. This slide shows the 4 main components of the report, and we're going to start taking a closer look and share some examples for each one. Okay. So beginning in the report provides an introduction, overview, and summary of findings. In this section, research findings, specific data provided that support the importance of well-being and its connection to organizational performance. So it gives you percentages tied to certain performance indicators for your workplace population. So for example, when people believe their employer cares about their well-being, they are more engaged, they're more likely to go the extra mile, they're also more likely to recommend the workplace, and they're going to be there most likely in a year from now. So it starts off sharing some of and summarizing that type of information for you. And then it goes on to provide top scores by each each wellness dimension, as well as opportunities for improvement by dimension. Those dimensions are health, which include exercise, fitness, nutrition, healthy weight, biometric measures, and chronic illness. The second dimension, well-being, will include managing depression, stress and anxiety, energy level, optimism and optimism, and work-life balance. And then lastly, the dimension of productivity, which will consist of work-related areas such as job satisfaction, belief in the organization, is it a good fit, things along those lines. Okay, so going on to the next component of the report, participation and demographics overview. This section gives you a breakdown of your organization's demographics for age and gender, and it's also going to give you a comparison of your organization's participation in SmartHealth compared to SmartHealth overall, specifically for registration, well-being assessment completion, and incentives earned. So just something to think about when you're looking at this particular chart and the presented findings. If there's a higher, let me back up. So for example, if you take a close look at gender and age, and if there's a specific gender, male or female, or a certain age category that seems to be represented more highly in percentages, those are important things to possibly consider when you're developing and providing your wellness program and activities. Moving on to the next component of the Wellbeing Assessment Report. This screenshot example is taken from the overall state Wellbeing Assessment Report. We wanted to consider and honor your privacy as far as your specific agency data and findings. So the remaining charts that you will see in today's presentation, again, are from the State Wellbeing Assessment Report. Okay. So in this component, for each wellness dimension, health, well-being, and productivity, you will be giving a breakdown of results based on the responses to the health-related questions in the assessment. It's going to provide highest to lowest average scores, and those scores range from 1 to 5, with 5 being the highest score. And it's also going to provide year-over-year change in risk, increase or decrease in comparison to SmartHealth 2016 overall. It also tells you and gives you actually a brief summary as to why scores matter. So for example, if there was a lower score tied to healthy weight, it will share a summary, for example, such as those who maintain a healthy weight tend to cost less to insure, have higher productivity, and are less likely to go on disability. So it gives you why it matters, that rationale as to why that particular health component is important to your workforce population.
Yeah, so just quickly, I think one thing that's really important for throughout the entire report, but also for this piece is, this is your entire population for your agency, and it really is trying to give you, we've heard a lot from all of you on making sure that you have data specific to your agency, that you can see what's going on with your organization or agency, that you can see what's going on with your population, and really dial in your program. Whether it's something specific on site that you want to do, bring somebody in to talk about, have an education event that you feature for a month, or even do a custom activity on SmartHealth itself. But to me, when I look at this, I think it's really powerful to be able to see how your population is either improving or not improving on any of these given dimensions, and then be able to actually take that information and do something about it right there in the building itself.
Okay, thank you, Bennett, for expounding on that a bit more. So for example, this particular chart emphasizes that back health and healthy weight, for example, are areas that could specifically be focused on, and actual, program planning, being pursued based on those findings to improve in those areas. Okay, so moving on to the year-over-year cohort analysis, which is provided specific to each health dimension, and that is going to compare average well-being assessment scores across the health dimensions for anyone identified as at risk. And at risk is identified as having a well-being assessment score of less than 3.5. So, okay, my screen is a little bit difficult. As you can see, this particular population, again, the state overall, all the areas, all the wellness components in the far left-hand column are listed, and then the year-over-year scores, and then it provides the year-over-year change in percentages. And for this example, of course, which is exciting, that they all have improved, which we will address more specifically in just a moment as far as cohort analysis study that we've conducted. Okay.
Yeah, and one thing I just wanted to mention quickly, I think you'll all see, obviously your reports are specific to your organization, so anything that's under 20 respondents, so if you have a smaller population of people with risk, you might see some of these data points are blank, and that's because we obviously take privacy and security very seriously, and so for HIPAA, anything that has 20 or less respondents won't be displayed so that there's not some sort of back of the napkin calculation about who's doing what, sort of where, when, and why. And so if your report is not showing any information in these fields, it's because you have 20 respondents or less.
Okay, thank you, Bennett. All right. Going on to the next slide, and actually Bennett will, I'll turn it over to him again because he's going to go over what was discovered and found for an overall cohort study done with SmartHealth. So go ahead, Bennett.
Yeah, so in what Pam was just talking about, right, so I think the mission really for SmartHealth is making sure that we're keeping healthy people healthy and improving the health and well-being of those with any risk. So that example slide that Pam just had really showed that those with any amount of risk really are improving. And so what we did was we're able to do a cohort analysis of which takes anybody who had a risk in 2015 across any of those dimensions. We were able to see whether those people, their average score, so it's not one individual person, it's everyone who did it, if they improved or declined from year to year. And so the really great thing here is that those with risks improved across all of our 34 dimensions. And in some instances it was really large, plus 20%. In some other instances it was 1 or 2%. But for us it was really a great indicator that at least in those first 2 years we really are reaching that at-risk population. And so as we've gone through some of these reports for each of your organizations, I think we're finding similar results, which is really, I think, exciting for us. And for me, it's one of those places where you can go in and talk to your colleagues, or you can talk to the leader of your organization and say, this really is a program that is working and that's having a positive impact and influence on all of the people who work here on their lives. And so let's do more with it, or let's focus in on this specific area to try to improve that a little bit longer. And so I think on the next slide, you'll really see that it's not only improving across all 34 dimensions, it's also really hitting the places that are top risks for the population. So again, this is for the SmartHealth population overall, but after 2015, we went through all the data and we identified what the top 5 risks were for the SmartHealth population, and this shouldn't be any surprise. It's given the demographics and the type of work that the state of Washington is doing, but back pain, that's usually caused from sitting at a computer most of the time, eating better and having better energy, and sleeping better, and then also weight. So those were the top 5 that we identified. And you can see on the right-hand side, when we did that cohort study, there was pretty good gains in each of those 5. And so back pain, a plus 22% increase. And then even that we include weight here because, if we're living in America and we're working in an office setting population, any positive impact on weight is really a big deal. And so we were really excited to see all these numbers, and hoping that, over the course of the next 3 years that we'll continue to see this improvement.
Okay, thanks again, Bennett. And now we're going to switch to a very important focus in today's presentation and overall is how to put this report to use. And what we've done is provide a list of SmartHealth approaches on this slide that you can use based on the amount of time you have dedicated for your wellness program planning and development. The overall list of recommended approaches provided on the slide include using existing SmartHealth activities tailored to your workforce needs, developing custom activities, Also developing promotional flyers for the activities that you're promoting, and also including executive leadership sponsored activities. And then lastly, scheduling and holding quarterly meetings with leadership and other internal stakeholders to assess and plan for your wellness program. So again, the continuum presented on the slide represents, again, the variance that you wellness coordinators experience as far as the dedicated time you have for your program development. On the far left end, this represents some suggestions, basic recommendations, and how to use SmartHealth approaches if having very little time. Again, using existing SmartHealth activities tailored to what you find in the report can be really targeted and focused with very little work involved, and that those activities are there for you and all the various domains and the wellness components that fall under those dimensions. For example, you can send out promotional emails providing a direct URL link to specific activities that they can focus on to improve in a certain wellness area. Also, if very little time is what you're dealing with, perhaps considering at least developing one custom activity, perhaps maybe starting with an activity that you have offered and done already year after year, a special fun run or other related event that you've provided and have put together on your campus or agency and has been attended and well engaged and participated in. You could place that within the SmartHealth as a tile, a customized tile with attached points to it towards their incentive. That can be really, again, very tailored to your workforce, as well as promoting, a specialized custom activity. And then developing promotional flyers for activities overall, specifically tied to maybe custom activities. And I want to stress that we here on the Washington Wellness Team, that's a very important part of what we do to help support you and guide and direct you based on how you'd like to develop your program. And we're available to help in any way in any of these recommended areas to help you grow and sustain your wellness program. I know some of you coordinators have already, offered executive leadership team sponsored activities where you're including key leaders and stakeholders within your agency or campus that are promoting and participating in the event, and that can be very motivating and uplifting to the workforce when the leadership is engaged at that level. It greatly increases participation and engagement. Holding the quarterly meetings, speaking a little specifically towards, with key leadership and other internal stakeholders, actually planning designated meeting time to assess, use the report for assessment and guidance again to help plan and grow your wellness program that again involves all the key players within your organization, and of course including in that how those key supporters in your organization can truly be engaged and be promoting all of what you're doing, all of your worksite wellness efforts. And then it goes on to share on each level, again, dedicated based on dedication of time, a list that hopefully is manageable and realistic. But again, please reach out to us and we would do whatever we can to help you plan and develop your wellness program and include these various activities. And Bennett would like to add in addition to what's been shared thus far.
Yeah, I think it's important just to pause here for a second and really emphasize that this is your program, right? And from our vantage point at sort of SmartHealth overall, we're able to gather the data and develop a program that's going to try to reach the entire population at that really large level. But the way that the platform and program is architected and really works the best is when all of you who are really close to the program and understand how your population is working, that you're able to really tailor it to your specific organization. And so any amount of time you have to dedicate that to that, I know working with Pam and Ron and Aaron and Susan, it really, we've tried to make it as easy as possible for you. So, you know, it's something as simple as saying, I've looked through the report and I want to do something on back health specific to my organization. I know all of us are really dedicated to making sure that if you have 5 minutes to say that to us, that we can do some of that work for you, some of that legwork, and get that up for your organization specifically. So, and we have, Limeade's really developed some of the tools behind, so when we say custom activity flyers, we've developed a really easy to use templatized toolkit that you can say, you know, along with that back health, I'd, you know, want to make sure that there's 3 tips about this. And so we can do that very quickly for you. And so to us, it's really trying to empower this report, and everything on this slide and everything we do is really trying to empower you to bring your individual culture to life. Because at the end of the day, the state really is a large and complex organization, you know, with over 600 plus organizations and different missions and values and goals across each of the important work that you do. So anything that you can do to sort of bring that home just a little bit more to the people in your office and organization is really going to help increase the outcomes and increase the health and well-being of everybody that you interact with every day. So just wanted to add, we will continue to try to give you all of the information that can help you really tailor and bring this program to life for folks that you sit near and work with every day.
All right, this slide shares a little more specifically and how we will support you. And first and foremost, we will meet with you to help you review and plan and further develop your wellness programming. We can attend meetings with you, with your leadership team and or your health and safety committees members to provide support, possible training, whatever you feel is needed to support your efforts. Also, we're here to help you create the customized materials to support your customized activities. Again, please reach out to your corresponding Washington Wellness team member to help guide and walk you through the request for custom activities and help develop those, as well as customized flyers to help with the promotion of that. And just very importantly, our goal is to continually develop resources and services to support your wellness program development. For example, we're planning to gather input from you coordinators in the near future, whether that's through a written survey or some focus groups, possibly both approaches and others. But what we truly want to do is to gather input from you on how we can further support you overall, specifically through resource development and service development. That's very important to us. We want to hear from you what your needs are and how we can revise, improve, and then build upon what we offer on our end to help grow and sustain your worksite wellness programming. And, you know, we're also using our state SmartHealth report to pull from to plan and develop our approach overall to support you. For example, key areas statewide that could be improved upon were healthy weight, back health, and sleep. So one idea as far as focusing on that area for 2018, providing comprehensive toolkits to offer to you wellness coordinators so that you will have ready-made resources available to develop customized activities, overall campaign, various other approaches to address these 3 key health areas. Okay. And then lastly, we want to always be looking at our existing resources and services against best practices and the cost impact they have, so that we can always continue to improve and revise and possibly add to those. So that's a bit of a summary as far as things that we have in mind to go forward. And we always want to hear from you as far as how we can continue to support you and improve upon that. So keep the lines of communication open. All right, moving to the next slide then, which this is truly represents why we're all doing this. You know, our workforce throughout the state, their health and well-being, keeping those that are healthy, keeping them healthy and building upon their capacity, helping those with risk, you know, helping reduce those risks, and also supporting and helping with managing a chronic illness and disease. But it's so enriching and a great reminder as to why we do all of this work when we receive, for example, testimonies. And from our 2016 survey, the SmartHealth survey, we did receive over 300 amazing success stories that involved quitting smoking to losing weight, to helping with back pain and dealing with stress. And on this slide, this just pulls from that 3 testimonies speaking to those changes, opportunity to improve issues they weren't aware of, for example, helping them break down their wellness goals into manageable, doable steps, dealing with stress more effectively in the workplace. And then I have to share yesterday, as you know, was the Governor's Walk, and it was a great turnout. And for those of you there, thank you so much for attending. And for those of you that held corresponding walks at your organization and campuses, thank you so very much. It was a great success overall, and it really ended on a positive note. The rest of the team and I were kind of packing up our table and tent, so to speak, and a woman made the effort to come over after the event and share with us that from the support of SmartHealth as an incredible tool and resource for her, she once weighed over 400 pounds and had lost quite a bit of her weight and was feeling great and energetic and so much healthier. She also shared with us that she was a 2-time cancer survivor, and she just really emphasized how important the SmartHealth Wellness Portal played in supporting her through her goals to improve her health. So I want to kind of end before we go on to questions on that positive note. So anyway, let's go on then to opening it up for questions and comments. So we very much want to hear from you folks. If you have any specific questions to the various components of the report, analysis, how you can use them, whatever is on your mind and questions that you may have. Okay, and I'd like to thank everyone again for participating and joining us today. It's greatly appreciated. Although there are no questions or comments that come to mind now. Oh, do you have one?
Yeah, I see, Nikki, you have a great example. Do you want to speak to this at all? I can see in the question, the chat window, that you're planning a seminar with a sleep specialist since your responses didn't improve year over year. So I think that's a fantastic example. It looks like you don't have the ability to talk. So I think, you know, the fact that you're looking at these reports, seeing what's not improving year over year, and then bringing resources to bear to be able to say, hey guys, this is how we can improve sleep. I think that's one of the ways we really love to see all of you be able to use this report. And I think the other thing to mention, we've also been talking about timing, trying to make sure you guys get these reports soon enough so that you can really incorporate each of these things into your 2018 program year. So I think that's a great example and just another piece where we're trying to give you what you need sooner so you can incorporate more quickly.
Yes, yes. Thank you, Bennett and Nikki. Okay. Well, as Bennett stated, we presented a lot of information today, and just please know that we're also here to help you understand the report that you receive and help you assess and go forward with that information informing your program development. So please know we're available to help you with assessing that report more specifically with you. So I'd like to thank Bennett Blodgett very much for all his participation and great information that he brought to the presentation today. There's a little bit of a glitch here and there, but overall I hope that you received important, information that you feel will help your understanding in utilizing the Wellbeing Assessment Report. So with that, I guess I'll close. And thank you to Jennifer Brown as well for all her great support. Goodbye, everyone. Talk to you soon.